The moment a person lights a cigarette and takes the first puff, thousands of chemicals enter the body in just a few seconds. As the smoke travels through the mouth and down the throat, it moves directly into the lungs. Although it may seem harmless at first, cigarette smoke contains toxic substances such as nicotine, carbon monoxide, tar, and many other harmful chemicals. Inside the lungs are millions of tiny air sacs called alveoli. These tiny structures are designed to absorb oxygen from the air and deliver. But when cigarette smoke enters the lungs, these delicate air sacs are exposed to harmful chemicals. Within seconds, nicotine passes through the walls of the lungs and enters the bloodstream. The blood then carries nicotine throughout the body at remarkable speed. One of the first destinations is the brain. In less than 20 seconds, nicotine reaches the brain and begins to stimulate nerve cells. This causes the release of dopamine, a chemical often called the feel-good messenger. Dopamine can create temporary feelings of pleasure, relaxation, or alertness. For a short time, the smoker may feel more awake or energized, but this effect does not last long. As nicotine continues to circulate, the heart begins to work harder. Heart rate increases, blood pressure rises, and blood vessels become narrower. The heart must pump with greater effort to move blood throughout the body. At the same time, carbon monoxide from cigarette smoke enters the bloodstream. This dangerous gas attaches to red blood cells and reduces their ability to carry oxygen. As a result, less oxygen reaches vital organs and tissues. Although the body may appear normal on the outside, important changes are taking place internally. With repeated smoking, the lungs begin to suffer damage. The airways become irritated and inflamed. Thick mucus starts to accumulate, making it harder to breathe. Tiny hair-like structures called cilia, which normally help clean the lungs, become damaged and less effective. Without these natural cleaning systems, harmful particles remain trapped inside the lungs. Over time, tar from cigarette smoke accumulates on lung tissue. The lungs gradually lose some of their ability to exchange oxygen efficiently. Breathing can become more difficult. Simple activities such as walking, climbing